know more about them and to listen to all the information they have to give us. How about we welcome here in the studio of Sunshine Dr.Maryam. Ibrahim al-Kendari specializes in peripheral neurotherapy, PhD from the University of Reading, UK, and Iman Rida al-Mshari, pharmacist, and they will talk to us all about it. Good morning and welcome to the Sunshine.
Good morning, Dr. Maryam. Good morning, pharmacist Iman. It's a pleasure to have you on Sunshine. And I want to go, before we go deep down, in UK and in the States, when you have a flu or cough or, just simple, thing,
allergies, let's say.
Allergy, you'd go to the pharmacist. You don't have to go to the GP. Definitely this is one of the main, issues we have to discuss in this conversation. But before that, let's, tell us, what does the word pharmacist mean, Dr. Maryam?
It's my big pleasure that today I'm with the Sunshine to be with you here on KTV2. We have, before we go and start with the clinical pharmacist, as a clinical pharmacist, we want to talk about the clinical pharmacy. The clinical pharmacy is an area of pharmacy with concerned with the practice and science of the rational medication use. What do we mean about the rational medication use? It's when the patient receives the medication, it should be in an appropriate clinical needs to meet. It's like when we have the doses of the drugs or medicine, it should meet the requirement of that patient and also at a period of time. And this also should be with the low cost to them and also to the community that they live.
That's really interesting. Iman, pharmacist.
Yes.
Well, we always call you doctor and whenever. So what does pharmacist really do and mean?
Our job as a pharmacist, we're licensed to be engaged in the pharmacy duties, dispensing the medications, monitoring some drug interactions in the prescription, monitoring also side effects. We're also engaged to counsel the patient properly about what he will get from this medicine and how to use this medicine, how to store these medications.
Well, how to store it as well.
Yes, of course.
So for example, if somebody comes and he has this huge allergy of something, Dr. Iman, this is really critical issue here, and and you prescribe some kind of medicine, and this would go south and will have side effects.
Yes.
So how would you manage kind of this in this kind of situation, or how would you prevent this from happening?
First of all, when we need the clinical pharmacist, because we have a differentiation between the pharmacist and the clinical pharmacist. The clinical pharmacist is the specialty trained practitioner that can be provided directly and work directly with the patient care and giving a comprehensive management for the patient themselves. So when we need these clinical pharmacists, we need them if we need an expert advice on the medication. It's mean we have the long-term conditions such as the asthma, such as the type 2 diabetes, we have arthritis and high blood pressure. So they should come for the clinical pharmacist so that he can work to see, he should care on that patient and how he taking this medication. Even sometimes we have a patient with a polypharmacy with many drugs or many medication. So he should, this clinical pharmacist, give and explain to the patient how he can take this all medication together. If he need
with no bad effect.
With no bad effect. Now one of the things that the clinical pharmacist show in his duty that he should give, if the patient experience a bad effect or from the side effect, he should also change the medication for that patient.
Absolutely.
This is from the doctor or the pharmacist?
From the clinical pharmacist, because the clinical pharmacist, he is apart from the GB team.
But Dr. Maryam, what I'm talking now I'm a patient and you have no history, I have no history, so you just first time met me. how would you prevent giving me medicine without having a side effect, for example? You have to ask me, right?
Yeah, for sure. In Kuwait circle here, we should like the patient, he should like refer to his GP first, then the GP he's wrote the prescription. At that time, I should check like on the drug interaction, some medication with a side effect. So I will ask the patient if he like suffering from like a diseases or some points that he didn't explain for the GP. It's like some part of investigation. So I will like have spend little time with that patient to explain about his experience with the medication, if he took it before or he want to, this is the first time for him.
Or if you take this and you have allergy, you will have
for
sure, such and such.
For sure. And I will let the patient know that there is like a patient leaflet in the medication.
Exactly.
So he can also, if he has any question and he couldn't come to the pharmacy, he can see this leaflet and he can find out the side effects.
In this way, we can overcome the GP lineup, the GP wasting time of the patient, the doctor.
Effort, yes, time and effort, saving time and effort as well. So I want to ask pharmacist Iman, we call you doctor all the time. It's fine. You said you, as a pharmacist, you teach the patients how to store their medication.
Yes.
Well, there is a problem sometimes we face, especially if we took a medication and we are okay after 5 days, but we have leftovers of those medications. Where to go? How to, let's say, get rid of these medications? How to deal with it?
Some of the medications, the leftovers or the extras, actually in Kuwait hospitals we do not take them back because we do not know how it's stored.
That's true.
And if it was stored incorrectly, it will affect the drug itself, so it won't work.
Okay.
So I think there is a place in Sabah hospital, they take these medications, the leftovers. But as hospitals, no, we don't.
So I think because some people don't know how to really interact with the leftovers of these medications. Yes. I think we have as well a phone call with Dr. Yusuf Shamsuddin from the United Kingdom of England, and he is really managed to contact us and tell us all about the hospital pharmacist, and he is an academic, researcher and everything. So hello and good morning, Dr. Yusuf.
Oh, good morning. Hello, everyone.
Well, welcome to the sunshine, Dr. Yusuf. And how is it down there in the UK, or up there, is it?
Well, first of all, thank you very much for your invitation. The situation down here is a bit lovely at the moment. I should express my feeling in daily morning today about having a rainy day. But overall, I mean, if we want to talk about the situation in terms of COVID pandemic.
Yes.
Absolutely, absolutely. Yes. Dr. Yusuf, first of all, this is a typical UK day, you know, the showers and cloudy and, you know, and having a shy sun.
Yes, indeed.
Dr. Yusuf, absolutely. I want to ask you about, you know, tell us about your experience as a pharmacist. We were talking about the clinical pharmaceutical, you know, how the patient in Kuwait, I mean in UK and in the States, if he has a flu, has any simple or basic, you know, need for medication or health issue, he goes to the pharmacy and he explains his situation for the pharmaceutical doctor there, and then he gets his meds. Tell us about this experience and how can we implement this in Kuwait?
Well, as you have just stated, the situation in the developed countries regarding the role of the pharmacist. I mean, the pharmacist in the medical sector in the developed countries is considered as the first line, while the public, they are meeting the medical sector. So as you stated, instead of going to the clinic or the hospital, if you feel any kind of experiencing any kind of common symptoms of common cold or flu, instead of going to the hospital and burdening or overwhelming the staff down there and waiting for in a longer queue, it's highly recommended that you visit any kind of community pharmacy where you find a qualified pharmacist who is able to assess your condition and your situation, and also to propose and prescribe the appropriate medication which can sort out your problem.
That's really great. I think, Dr. Yusuf, we know that you have been here in Kuwait and now you are studying abroad. So tell us about the studies you did throughout the pandemic, especially that we have here in the studio Dr. Maryam, who is in the neurology, the peripheral neuropathy. So can you tell us a little bit about your studies?
Oh yes, I mean when I was in Kuwait during the pandemic, I worked in two hospitals, and one of them was a private hospital, which is the Kuwait hospital. The other one was the public, the governmental hospital, which is the Al Adan Pediatric Hospital.
Yeah.
And I should say, during my experience in Al Adan Pediatric Hospital for 9 to 10 months roughly, we managed to publish 2 case reports in managing rare conditions in pediatric patients. And this adds a lot, in my opinion, in changing or somehow influencing the way of managing these rare cases in pediatric patients, especially where you don't find a convenient route of administration for these patients because of their compromised body size and body weight. So the patients mainly cannot be administered an IV drugs, which is the intravenous, because they compromise body weight and size. Therefore, we propose changing the route of administration from IV fluid into oral route, and it really worked very fine. And I think there is a kind of a minor change on managing these conditions at the moment in Al Adan Pediatric Hospital based on our recently published case reports.
Okay, well, I think you are going to do much more with the studies, and I know that each and every one of you, we call the White Army, has done a lot to us. Thank you very much.
We wish you the best, Dr. Shamsuddin, and I hope you return to Kuwait safe and prosper, definitely, with your education and research. Thank you, Doctor.
Thank you very much.
Dr. Maryam, now we want to go to another topic, and this is very important. Tell us, first of all, what is the peripheral neuropathy, and what are for example, the common causes of this disease?
Peripheral neuropathy is like the diseases that related to if there is like a mistakes in the neurons, or if it's not giving us a proper for the hands proper what we can say, it's like a sensory from the brain to the hands or to the legs. So
messages from
like not only messages, it's like the sensory or the signals itself to the hands and to the legs itself. So it has many symptoms.
So it's like numbness,
tingling. Some parts, sometimes the patient, they are suffering from like coldness in their fingers and their hands.
I get that a lot, coldness in the hands, when I'm in a cold area, for example.
So the main cause of this disease is like, some of the type 2 diabetes patients, also, the sport injuries is part of this, is part of the causes.
Some neuropathy.
Also, this disease has like much complications, such as the renal, they will feel like a renal failure if they are not like, overcome the causes and take their medications. There is a lot of medications. We have like the Lyrica, carbamazepine, we have like the Neurontin, but my study is focusing not only about the physical part, but the psychological part. So we need, this is what we say, if we have also the clinical pharmacists, and this is a new like services that we give the patient, the psychology parts.
So this is big, I think.
Because we have a lot of patients who like feel that they have like an impact on their quality of life, such as they feel like a lack of sleep, especially for the people living with the neuropathy, peripheral neuropathy, we found a lot of them, they feel like a social isolations and also like a mood swings. So how we are like a clinical pharmacist or a doctors, especially for also the healthcare provider, to overcome these things. So we we spend a lot of time with the patient, like from 2 or 3 interview with them. So we find out that really they are suffering from this psychological part, because they have a lack of access of the information.
Yes.
And they have like also a lack of the relationship between them and the health.
This leads me to another question, the pharmacist Iman. I think Dr.Maryam have said a lot about the psychology, but sometimes when you go to the pharmacy and we already had that medicine, when do we expect the effect of the medicine that comes to us? Like if I have a headache, I take 2 pills of, like, let's say paracetamol or anything.
Yes.
So what about the other medicines?
For example, she means if it's not taking effect, what she should do?
Usually the pharmacist would say for the patient when the effect will occur.
Yes.
Like some painkillers within 30 minutes to 1 hour. Some medications for chronic use, they need like weeks or months for the effect.
You will give us when the effect will be?
Yeah, I have to make sure that the patient will take the medicine and not stop it. Like we have the antibiotics. The effect will show after 3 to 5 days.
Okay.
And some patients, when they feel okay after the 3rd day, they will stop it. When they stop it, the resistance of the bacteria will increase.
Okay.
So we have to make sure that they will adhere to the medicine and complete the course.
Well, this is really great.
Absolutely, absolutely.
This is most of us with the antibiotics.
We cannot get enough of the doctor and the pharmacist, honestly, you know, but unfortunately we are out of time. Dr. Maryam, thank you very much. Pharmacist Iman, thank you very much. It's a pleasure. And I wish, you know, we see you in Sunshine more often.
Thank you.
Thank you. Well, yes, for sure. We need more information. We need a lot of that, because, dear viewers, you know, each and every one of us is really aware of how important our health is, especially during those 2 years. So, as my colleague Farid just said, it is really, time runs fast, but how about a quick break just to get that time stopped?